can't know someone has COVID-19 just by looking at them, but you should know that everyone who wears a mask has a reason to fight it.
My daughter.
My health.
Going out.
Mi familia.
My wife's high blood pressure.
My community.
My friends.
My sister.
My son's acid.
Mi abuelita.
Shopping.
My job.
Respect for others.
Whatever your reason, get behind the mask. Learn more at covid19.ncdhhs.gov.
WAR 1520 AM in Warrenton, North Carolina, and your hot 103.5 FM. Super morning going out to everybody out there. And of course, over the past couple of days, I've been talking to you about the rise of COVID cases across America as well as in North Carolina. And over the past couple of weeks, been just sort of throwing some numbers out there at you. But I have in studio this morning someone who is, I guess you might say, really close to this subject, who knows a whole lot more about it than I do, as a matter of fact. And so glad to have her in this morning. Also, young man, both of these people I haven't seen in quite some time, so let me go ahead and tell you. In the studios this morning, County Manager Mr. Vincent Jones, and also, of course, the Warren County Health Director, Dr. Brake, is here this morning to sort of put a closure on some of the things that have been happening, first of all, here in Warren County pertaining to COVID-19, and then I'm pretty sure that she's got some information that she can share with us as far as what's going on across North Carolina. And of course, I know she's got some tips as well that she's going to be passing along to us to try to help us get through the Thanksgiving holiday, actually every day, but of course the Thanksgiving holiday with it being right around the corner. So I guess I'm going to start off this conversation this morning by saying good morning to you, Dr. Brake. I'm so glad to have you back in the studios this morning.
Good morning, and thank you for having us.
So I hope that everything's been going absolutely well for you.
It has.
And I want to say before we get into the conversation, you guys have been everywhere, man, as far as doing your. I want to say God's blessings to you guys for doing everything that you possibly can, within your power, to try to get as much information out here to the people concerning COVID-19, and to try to get as much testing as possible out to the public here in Warren County. So glad to hear, glad to have you. Also, good morning going out to our very own super. You like that?
Wait a minute.
Mr. Vincent Jones is in the studio this morning. Good morning. How you doing, Mr. Jones?
Good morning. I'm doing well. Thank you.
So glad to have you as well. And once again, as I always say, I think you're doing a great job here in Warren County. Okay, so just keep on doing what you're doing, man.
Thank you. We certainly appreciate it.
Okay, thank you very much. Okay. Dr. Brake, you want to open up the conversation. So how's things going with COVID-19?
Well, just like other counties in our region and in the state, we are also seeing increases in new cases of COVID-19 in Warren County. We have a total of 566 total cases now. About 92 of those are active cases. So the majority of individuals have recovered, which we're very thankful for that. We have 2 that are in the hospital, and we have 8 deaths. So on Monday, we saw our 8th death from COVID-19 since July. Mm-hmm. So it's not bad, but whenever you lose someone, that's always not a good thing. So we do send our condolences to the families that have been impacted by COVID-19, and just want them to know that we're thinking of them and supporting them also during this time.
I gotta ask you, the thing that's the one of the biggest news things that's going on now is the rise in COVID-19. We here in Warren County, we were doing very, I think we were doing very well. I think the last time we all were here,
yes,
we were doing, but what happened? Can you sort of pinpoint what happened?
Well, I'll just start by saying I think we're seeing a lot more community spread of COVID-19 cases, and that is people who are getting COVID. Some may not even know how they got it. We have cases where, individuals have contracted the virus, and it may have been, affected their family. So the spouse may have also gotten it, the kids may have gotten it, or a caregiver take it and give it to someone that they're taking care of, or their parents, elderly parents. So the transmission is seeming to be more widespread than before. And I know part of it also is, we're in phase 3 of the governor's executive order, so
Right.
things are opening up a little bit more. And I think people just need to be mindful, and we all need to be mindful that even though we're in phase 3, we still have to do things that protect ourselves, our families, and our loved ones from contracting COVID-19.
You can jump in.
Sure. Well, thank you. And Dr. Brake is exactly right. The thing that I would add to the conversation is we have been under our emergency declaration from the state and here in the county for 9 months, and we have not seen an extended emergency like that. And so I think people are suffering a little bit from fatigue. People are getting a little weary of having to wear the mask and keep their distance and isolate. And I think that does exactly what Dr. Brake says. It causes people to drop their guard. And so the purpose of us today being here is really to sort of encourage people, remind people that we still have an emergency here in the county. We are a rural community, and sometimes that means we have less access to health care and options, and so it tends to hit us here in rural communities a little bit different. And so I want to make sure that we remind our residents that we have to stay vigilant so we can get through this and then hopefully see some sense of normalcy on the other side of this.
And also, I want people to recognize, and I think you brought this up in one of the conversations, that when we talk about Warren County, it's a pretty nice. It covers a lot, and so it's because sometimes people say Warren County, you just think Warrenton, but we're talking the figures and numbers that you have are county-wide.
Countywide. Yes.
Okay. You know what I noticed? A lot of states that sort of like just opened now. A lot of states, and I'm going to let you as county manager, sort of kick this off. A lot of states are now reevaluating that opening, and they are either shutting down some things or are implementing restrictions.
Right. And so you're absolutely right. We tried to take a conservative approach, and so while we were still open doing county business, for example, we had our doors closed. We were asking our residents to make an appointment, to undergo a health screening, to use online resources before you actually came into the building. But yes, as we see this surge, that's one of the things that we're going to have to look at. For example, we have been having some in-person meetings. We've been making sure that we have been keeping the number of people who attend those low, but we are looking at that. We're probably going to have to even lower the number of people, and for our committees, for example, move them to a virtual format just to keep people safe, because we don't want to, like I said, expose people unnecessarily to any potential for them getting sick.
Go ahead.
Yes, and just to piggyback on what Mr. Jones said, I think we just have to continue to get behind the mask and remember the 3 W's. I mean, those things are so simple, and I know people have different views on the mask, but for us, it's a public health issue. It's not a political issue. It's not a statement. This is how we can protect each other. And the CDC, recently came out, I think about 2 weeks ago, initially when we were talking about wearing the mask, we were saying, wear the mask to protect other people. But the research from CDC now says you not only wear that mask to protect other people, but it also protects you from being exposed.
Absolutely.
And so we want to make sure that people understand that. I know, as Mr. Jones said, we all get tired. We all get out of our cars sometime and forget to put it on and have to go back. But it's a critical reason why we need to do that. So wearing the mask, trying to social distance yourself from other people as much as you can, and hand washing, just making sure that we are, being good about our hygiene, especially if we're caring for other people. I mean, all of those things are important, and that's something everybody can do. And so on Tuesday, the state announced a new COVID-19 alert system. I'm sure many of our residents saw it on the news. And it put counties into different categories based on their rate of transmission of COVID-19. So Warren County, well, the 3 are yellow, orange, and red. Okay, so yellow is significant spread, orange is substantial spread, and red is critical spread. So Warren County fell in the orange range. Okay, and so that means we have substantial community spread in our county. And so this is data that the state will be generating every month, the second week of each month, to kind of let counties know where they are in this metrics of transmission for COVID-19. And so while Warren County is in the orange, I think there are, these types of strategies we can continue. But one of the goals of this whole new alert system is to make counties aware that there are things that they can do. So everybody has a role, whether it's an individual resident, whether it's a community organization or a business or a public official. So everybody has pieces that they can play to help reduce the spread of COVID. And I think that's one of the things the governor is trying to let counties know, that you all have a role. And really for us to roll back to where we were, and I just go back to September. In September, we had our percent of positive cases was at 2.5%. Now we're at 7.3%.
Okay.
And we know some of that is due because we are doing more testing, and we appreciate the fact that people come out, because that is critically important. But also we're seeing that we are seeing more people who test positive.
Right.
So that makes us think we really have to hone in more and be more diligent about implementing the 3 W's.
I wonder how far along, or how much higher will the numbers have to go before there may be possibly another stay at home.
Well, so that's what Dr. Brake was just mentioning about the governor with this new system is really trying to put some onus back on individual communities. And so we can look at the statistics for our community and decide if we need to do one of those things, whether it's statewide or not. And so at this point, all options are on the table. And so we just want to make sure that we continue to get our residents to try to keep each other safe. And Dr. Brake made a great example, and I'll tell you from personal experience, I'm so glad that I listened to Dr. Brake and wear my mask, because I had an incident where I was exposed to someone who tested positive after our interaction, and thank goodness I had my mask on the whole time, so I had to come talk to Dr. Brake. She told me to go get tested, and thank goodness I was negative, but it was, one, a little scary to be in that position, but two, I was thankful that I had my mask and observed the appropriate protocols. We want our residents to do the same.
Fast forwarding, as we get ready to go into the Thanksgiving holiday, give us some information on how we can possibly, as safe as possible, get through that without any critical damage.
Sure. So if you look at the report about the county alert system, and I think we posted it on our county website so that our residents can have a look at that. There's a list of actions that individuals can take, that community and business organizations can take, as well as public officials. So there is a menu. I would say, the critical thing is that we have to rethink our family gatherings, because we're all used to having big Thanksgiving dinners,
Right.
and all of our family members, coming over. But the guidance from the Health and Human Services Department is that we should be rethinking that. And I agree with that, because we have family members that come from all over, and even in just neighboring counties.
Right,
I mean, we have that. And so the recommendation is, one, that if you have a gathering, that you limit it to 10 or less people, because that is what the indoor mass gathering limit is now. But also that you limit your interactions with people who are not in your household.
Right.
And so I know several people that I've talked to, they have decided with their families just to have a Thanksgiving dinner with their immediate household.
Right.
And that is the recommendation, that you just, have dinner with your household. And then the other thing is, if you're going out, we have Black Friday shopping after the Thanksgiving holiday, is to just be mindful of being in crowds, especially if you are a part of a vulnerable population. And that includes our seniors, it includes individuals that have chronic health conditions like diabetes and high blood pressure. So all of these individuals have to be extra careful as they're out and about in the community. So I think all of those are really important. The gatherings, I think, are probably most important, and just trying to practice the 3 W's wherever you go. And then if you are in a vulnerable population, I think we're having to go back to staying home as much as possible.
That's it.
Unless you have to go out, do the work, or to get your medicine, or go to a doctor's appointment, get groceries, those types of things that you consider essential. But other than that, those individuals need to remain home as much as possible.
I think it's really cool, and it's really great that Warren County, as of yet, we haven't put the kids back in school yet.
No, there's still.
I think it's great. That's one of the things I was thinking. Just seeing other cities, putting the kids in school, whether it's on a, you go this long and you come. I think it's, once again, I really want to commend, you guys for keeping that information out there, and just keeping the kids home right now. Just let them keep on doing their virtual learning, man. I really do, because in those numbers, as far as deaths, there are children in those numbers. In this number I saw this morning, almost close to over 250,000 people have died. And there are children, whether people know it or not, there are children who are in that number. So once again, I want to really commend you guys for doing your job, man.
Well, thank you. But schools has been doing a great job. They have been sort of looking at the direction and advice that's coming from the State Department of Public Instruction, as well as using Dr. Brake's expertise as well to help them with their decision making. So, yes.
And we're fortunate. I mean, in Warren County, we have not seen any deaths for children, thank God.
Right, yeah.
But we do know that all age groups have been affected.
It's crazy. I think it started off with just the old people, and then it started dwindling down to maybe maybe 30s and 40s, and it just dwindled down to the teens, and then. Yeah, I really think it's crazy. How important do you think it is that we get tested, or does it make any difference that we get tested before our Thanksgiving holiday?
Right. So we do know that about 35 to 40% of individuals are asymptomatic, so they don't have any symptoms of COVID-19. But it has been stressed that if people plan to travel, that they may want to get a test before they leave. Okay. But I do stress to people that getting a COVID test is a point-in-time test. So if I get tested today and my results come back and I'm negative, that doesn't mean next week I can't contract COVID. And so that's why continuing to do the 3 W's is so important, because that test is just a point in time. But yes, so individuals who are traveling, certainly it would be recommended that they get tested. If you think you may have been exposed, even if you don't have symptoms, that is a good reason for getting tested. And of course, if you're not feeling well and you're having symptoms, you should also get tested as well.
I also read in here how we are something called a twin-demic that we may have to play, that may play a part in this, is whereas having the flu and Corona at the same time, COVID-19 at the same time. Can you speak a little bit on the importance maybe going ahead and getting the flu vaccine?
Yes. So we are in the beginning of flu season, and flu season can extend all the way through May.
Oh wow.
So we do encourage people to get the flu shot. The CDC is recommending that individuals get the flu shot. Because if you look at the strategies for COVID-19 and the flu, they're really the same. So if you look at wearing a mask, hand hygiene, and getting a vaccine, that triple protects you. So if you get the flu and you get COVID-19, the fact that you've had the flu and not been vaccinated increases your risk for complications if you get COVID. So getting a flu shot is really important, especially for those vulnerable populations, that is critical to try to get the flu shot. So we do encourage people to go ahead and get the flu shot. And so it's kind of like an additional protection. So not only from the flu, but in case you do contract COVID-19.
How about, so we are also right on the cusp of a vaccine now. What are your thoughts on what are your thoughts on that?
Well, I think it is exciting that we are at a point where we have, I know in the U.S. we have two companies, Pfizer and Moderna, that have very promising vaccines, and they're like at 95% effectiveness. So that is wonderful. And I think as they seek authorizations from FDA, then hopefully in, a month or so, we will have a vaccine. But everybody may not get the vaccine.
That's the thing right there.
So we have to be thinking about why the strategies are so important. Why we have to, even when we're tired, we still have to continue to do those things because we know everybody may not get the vaccine. So that's a critical point. It's great that we have it. I'm excited that it's on the horizon because we do need a vaccine.
Because I know, it seems like a while ago that I talked with you all, and we brought I talked about the idea of a vaccine coming up, and it was like, they're working on it, and it's like now it's almost here. At least they're working on it anyway.
Yes.
As county manager, how will you continue to play a part in getting us through this?
So we will just try to stay diligent and, make sure that we are following the advice of Dr. Briggs, that we're listening to the State Department of Health and Human Services. And, sometimes it may not be the popular decision, but we're going to have to make sure that we try to keep each other safe. And so that means if we have to go to some more strict emergency declarations, then that's what we'll have to consider if we need to stay home or go back to a curfew. But we really just want to keep people safe.
That's what it's all about.
Exactly. And so we're trying to make sure that we get the word out. So we appreciate you having us today, and we want to make sure that we support Dr. Brake as our public health director and making sure that she continues to do the outstanding job that she is doing in helping us get through this pandemic.
You have two events that are happening today and
Yes.
are pertaining to COVID-19.
Yes, so we have two testing events this week. The one today is at the Roanoke Wildwood Fire Department, which is up near Lake Gaston. The address is 790 Lizard Creek Road, Littleton. That testing event will be from 3 o'clock to 6 o'clock today. You don't have to have an appointment, no co-pays, but you do need to bring your ID and your insurance card if you have insurance. And I really want to stress for these events that we are especially reaching out to individuals who want to get tested but they do not have insurance. So we want to make sure that if you don't have insurance but you want to get tested, that you are able to come to these events to get tested because it is free. And you will be able to get a COVID-19 test. So that one is today, and then tomorrow from 2:30 to 5:30, we will be having a testing event at the Warren County Health Department. So we invite people to come out. The time for that event is 2:30 to 5:30 p.m. And I just want to give a shout out to our partners who are helping us with this. The one today, the fire department, Roanoke Wildwood Fire Department, as well as Olive Grove Missionary Baptist Church. So thanks, Reverend Walton, for that. And then tomorrow, Perfecting Praise Ministries is our partner, and I want to give a shout out to Bishop Terrell Alston and his congregation for supporting those events. And of course, our long-term partner on this is Hope Regional Medical Clinic. So thank Dr. Damara Russell and her staff who are working diligently with us to increase access to testing in Warren County. So I do appreciate all the volunteer fire departments, the churches, and all the partner organizations who are assisting us and helping us to stand up these community testing events.
Right fast, after you take the test during the drive-through testing, how long is it before you get the results back?
Typically, it's between 2 and 4 days. And a lot of that depends on the lab and how quick they can turn around the results. So as soon as they turn around the results, individuals who get tested will get a phone call for these events from Dr. Russell's office. And she usually calls those who test positive first. So if you don't get a call, don't worry. But that's usually the process.
Thank you. Thank you very much, Dr. Brake, for taking time. I know you're very busy as well, but thank you very much for stopping by with a lot of information. I hope everybody out there took the opportunity to make sure that you're listening and recorded some of this information that's been put out there for you, for the betterment of your health within this COVID-19 pandemic that we're in. I want to thank also our very own county manager, Mr. Vincent Jones, for stopping by as well, leaving us with a lot of information during this COVID-19 pandemic that we're in. Any last words from, I'm going to start with you, Dr. Brink.
Yes, I will just say very simply, continue to practice the 3 W's, get behind the mask. We need everybody to do that.
You know what? I can't say much more than that. I agree with that, and let's keep each other safe.
Thank both of you for stopping by this morning.
Thank
Have
you.
a safe and super Thanksgiving. All right.
You
Thank
too.
you.
Thank
You
you.
too.
Thank you.
Thank you.